Okay, we've got Lundy Williams, certified registered nurse practitioner, who I'd like to introduce here at Raggio MD. So Lundy, what do you do here at Raggio MD?
I'm a nurse practitioner that optimizes patients and gets them ready for any type of cosmetic facial surgery.
I love it. That's what we're going to talk about next is what is medical clearance? What is medical optimization, this term that you threw out, and why do we offer it here? How do we get patients optimized, their best version of themselves to get the best result for surgery? Let's dive in. Give me one aspect that you're looking at when people come in that we're trying to optimize.
Blood pressure,
Blood pressure, where do we want it?
less than 120.
Okay, are you making that number up or is there some definitions we're following, protocols?
We're following the AHA guidelines. Anything less or greater than 120 is considered elevated blood pressure.
And why that's important from our perspective, especially in our facelift surgeries. We know that elevated blood pressure above 120 is going to escalate your risk of hematoma, blood collection underneath the skin, by 7-fold. That is huge. Let's talk about another thing.
Nicotine.
Nicotine. Tell me, what are you asking folks to do? How are you helping them? Because it's a hard habit to kick.
It's a hard habit to kick for sure, and there's so many ways to utilize it these days. The biggest thing is just catching it early because we want people to stop it for 8 weeks before surgery and 8 weeks after, and helping them through nicotine patches, gum, lozenges, and counseling them through the process.
Sure. And where that affects us is nicotine affects your wound healing tremendously. And we also know from our facial plastic surgery literature, it can increase bleeding and hemorrhage hematoma risks as well. What's another thing?
Supplements and nutrition.
So many supplements. What are you seeing out there? Where are people getting their supplement information? Give us some guidelines here.
There are so many supplements out there. There's so much information on social media about supplements, and so we just really narrow it down to a list of supplements that will help with wound healing, decreasing swelling and bruising, and your overall recovery process, and then as well as giving you information on supplements that need to be stopped prior to surgery so that you have a decreased risk for bleeding and interfering with the procedure itself.
Yeah, supplements, it's challenging, but that's why Lundy's here to tell you which ones we know work, which ones don't, when to stop it, when to start it. So rest assured, she's got you covered from that aspect. Last thing that I'm thinking of, very common in our population, GLP-1s. We're talking, what are some of the brand names of these things?
Manjaro, Wegovy, Ozempic.
And many more to come, I'm sure.
Yes.
What are you telling people, or how are you helping them with this? Like, why is this important?
Well, the main reason that it's important is for safety. So we have patients stop the medication in a reasonable time before surgery, especially when it's for weight loss, so that they're safest for going under anesthesia. And then after surgery, we give them a timeline to restart it just to help with wound healing and the transferring of fat grafting and that kind of things that we want their nutrition well.
Absolutely. So it's safety, it's optimization. That is Lundy 101. If you had to summarize Lundy, that's what it is. But these are just a few of the common things that Lundy and our team are really going to be addressing, making sure you're safe and optimized for surgery. So just know you're in good hands. We've got an expert in the whole perioperative setting, and just know that we care about your success and your experience. So we encourage you to come see us. And if anyone has any questions, reach out to us. Lundy's a vat of information, but we hope to see you soon.